and we're going to talk about headaches and how we can help people that have headaches. And we wrote a corresponding book to go with this webinar. It's currently available on Amazon with the same name, The Headache Fix. So if you're interested in getting the booklet for this webinar or for follow-up, certainly go to Amazon. I'll give you the QR code at the end. So I'm a chiropractor. I'm a health coach. I've been coaching people on preventative measures, lifestyle changes to improve their health. I'm also an author who has written over 10 books now on Amazon. So people have headaches and they have recurring headaches. It's common for a patient to come in and say to me, you know what, this is the third headache that I've had this week. And, you know, the ones who have really bad headaches like migraines, they sit in a dark room, close the blinds, they reach for some pill or medication to help with the headache. It does help for a few hours to take the edge off, but the headaches come back, and they always come back days or weeks later, and there's a cause for the headache. So people sometimes start to think, well, I'm just born with it, or it's just something I have to learn how to live with. But I think it's important to address the underlying issues and know that you're not imagining that you have headaches and you're not stuck with it. So we're going to talk about changing the pattern, not just survival mode, but we want to be able to correct the headaches. So it's not in your head. A lot of times people are told, well, I have headaches and it's in my head. They get tests done, x-rays, CT scans, MRIs, can't find anything, and it's coming from their neck. And so when there's misalignments in the neck, especially under the skull at C1 and C2, that causes headaches. And I can't tell you how many people have come in with a misalignment. We call it a subluxation at C1 or C2, and that's causing pressure on the nerves and the blood vessels, resulting in headaches. The pressure builds up, the blood flow and nerve flow gets squeezed, and then what happens is not enough nerve and blood flow are going up to the head, causing headaches like migraines. And this isn't something new. You know, chiropractic and chiropractic techniques started a long time ago. In fact, there's writings from Hippocrates on chiropractic adjustments. So adjustments to the joints and the spine. There's many different healing traditions over the years, ancient societies that have used manual therapy or manipulation to help. And chiropractic became more formalized in 1895 when Dr. Palmer created the profession, basically formalized it into a healing profession and named it chiropractic. So this is the oldest medicine. It's not a fringe one. It's been around for thousands of years. So pills do help with headaches or migraines, but they kind of quiet the alarm. They don't really touch the wiring. So a rescue pill dilates the blood vessels for temporary relief, wears off in 4 to 6 hours. There's no dealing with the cause of the symptoms. So it's symptom-based. It's kind of an outside-in approach. And they're used often. So the medications or pills start to be used more frequently, increased dosage to deal with the symptoms. So after a while, there can be even getting used to the medication, the body adapts, and there can be a rebound effect that you can get from that. The other approach is to address the cause. So find out where the headache's coming from, like the upper part of the neck, to do the adjustments to restore the blood and the nerve flow, reverse the cycle that's developed over time. So it can start with a misalignment in the area. The muscles tighten, the nerves and blood vessels are constricted, and that cycle can be there for a long period of time. Like let's say somebody has a car accident 2 years ago, and this is the start of that cycle. You know, this pattern can be well established for already 2 years when the patient comes to see us. So as we start doing the adjustments, there's fewer, more mild headaches. And then eventually, the goal is to get rid of the headaches completely. So the cycle is misalignment, causing muscle tension. The muscle tension causes poor posture. Pressure develops on the nerves and blood vessels, more misalignment, and you can see how this cycle can continue. So a small misalignment creates tension. Tension pulls the posture out of true position. Poor posture feeds the misalignment, and it winds tighter each time. So we want to break that cycle and start the unwind to get the body back to where it should be. To start the unwind, we want the adjustment to reverse the cycle. So we do the adjustment to improve the position of the bone. Now, when we do an adjustment, it's not going to correct 2 years of misalignment in one session. It's going to improve the alignment somewhat, but it's going to take time to repattern the spine. So it may take many adjustments to get the body to improve and to get back to the way it was. So the way I look at this is kind of like layers. As we start doing adjustments, we're peeling layers off, and eventually we get down to the base layer, remove it, and we have the new position, the improved position of the vertebrae. So it's a pattern that needs to change over time. When we do the adjustment, there's a release, the pressure lets go, the flow returns. Person feels better. That's encouraging. They feel like they can turn their neck more. They feel like they can do more. They take better care of themselves. They eat better, get enough sleep. And then we want that to hold and to go to the next step. So 2 steps forward, 1 step back as we go through the process. And we want to teach people what they can do for themselves to help the process at home. Often when people come in and get the adjustments, they say, why didn't I do this sooner? For example, a straight A student who came to see me in grades were slipping, not from effort, but from headaches that were wrecking their focus. The telling detail, the phone in bed every night, head curled or curved forwards in front of the screen, causing a pivot point in the neck and tension up there. So the results were gentle, age-appropriate care, and some changes at home. And over several weeks, not just overnight, the headaches faded and the focus came back. The grades came back and they became a grade A student again. So this is what the unwind looks like. Some things you can do at home for yourself when you have headaches. One is hydration. I say water and electrolytes a little bit and often to keep your body well hydrated and keep the ionic gradient, meaning make sure the cells have the proper amount of salt, potassium, chloride, all the basic ingredients they need to function properly. You can raise your screen up, bring it up to eye level, so it stops that text neck or the head being forward like I used in the last example. That can happen just from sitting and having the head forward. It can happen when you're in bed, propping your neck up. Gentle neck care like chin tucks, upper trapezius stretches, slow rotations of the head. These all can help with the range of motion. Sleep's really important. Keep the phone out of the bed at nighttime. Put it down, listen to some music or a podcast, and create the right environment for sleep. A cooler room, couple degrees cooler, the blinds drawn, a darker room, nice and quiet. That'll lead to melatonin being produced in the brain. And in about 30 minutes, you're going to get pretty tired and want to fall asleep. And then get assessed. Go to see the chiropractor. If you're in the Kelowna area, come to see us. If you're not, you can see a chiropractor in your area. If you need our help, we do provide health coaching services. We can definitely find a chiropractor in your area that can help you with this condition. For the book called The Headache Fix, it's on Amazon. It's got everything that we went over in this webinar, plus a bit more. So it talks about the full cycle, chapter by chapter. There's some supplements in that book as well that you can take. Some exercises, postural fixes, and sleep tips. What to look for in a good chiropractor, and a chapter just for parents and kids. So you can get that on Amazon. There's the ebook version as well as the paperback, And then the audio version is going through the approval process. Should be any day when that's going to be available. So you have the three options there. You can come to our clinic, of course, in Kelowna, or if you're not in Kelowna, go to our website, truenorthexperts.com, if you want a health consultation, a health coaching consultation. If you're interested in our mastermind group, we have a limited amount of spots. We're going to dive deeper into these concepts. So we're going to get into these slides and expand on it. So each week, for the next 4 weeks, we're going to talk about posture, let's say, on one of the sessions. Then supplements in another session, which you can take to help yourself, and diet. We're going to talk about exercise on another one. So we're going to do a deeper dive into what you can do to help with your headaches. And we do that in the form of a mastermind group, a 1 hour session once a week for 4 consecutive weeks. We allow people to ask questions in that mastermind group and participate, give them a bit of homework until the next session. It's more of an interactive format than the webinar. If you want to do some one-on-one coaching, we do have that service available as well. So if you're not, don't want to do the group, or some people go through the group, the mastermind, and then they want some one-on-one advice, then we're offering that as well. You can just click on the link in the show notes here, or you can also click on the QR code, which I'm going to give you in a second, and then you can book your first consultation online. So I want to thank you for joining me today. If you're in the Kelowna area, you have headaches, then book a new patient examination by scanning this QR code in the top right. It's our website is tuttstreetfamilychiropractic.com. For the mastermind group, you're going to want to go to our truenorthexperts.com website, which is our consulting site. And if you're outside of Kelowna and just want a discovery call, truenorthexperts.com, book a one-on-one consultation at True North. I want to thank you for joining us today. If you have any questions, you can drop them in the comments below, or you can DM us, and we'll talk to you soon.